after they have had surgery. And I will say, after they have had surgery means we see people as early as 2 weeks post-surgery with a doctor's permission, all the way up to 60 years post-surgery. And the good news is we've been able to help people even when it's been decades after they've had their surgery. The book is written in 3 sections. The first one is called Awareness. Partly awareness because most people don't understand that what they've been feeling in their body, specifically decades later, years later, what they're feeling in their body is related to a surgery they had in this area of their body. Partly because there's not a lot of physical therapy or occupational therapy after you've had these types of surgeries. So we wrote the book as a questionnaire, this part of awareness. We asked the person, the reader, hey, have you had any of these types of surgeries? And we listed probably about 20 common surgeries that people may have, like C-sections, hysterectomies, mastectomies, gallbladder removals, very common type surgeries that we see in our office with our clients. The next page goes on as a questionnaire of, have you experienced these type of symptoms? And symptoms can range from chronic tightness to chronic pain to constipation to respiration or problems breathing. And when we say pain or tightness, it could be pain and tightness in your neck, your back, your shoulder, your hip, your foot, your knee, any of these things. So the first part of the book is awareness. And then the second part of the book is education. Because to know what's going on is one thing, to understand that, hey, I had this surgery 2 weeks to 60 years ago, but now I have all these symptoms. Okay, great. I'm aware of these things, but what do I do about it now? So we go on to then educate you about what is happening and why in your body. And then finally, there's a third subtitle with this book, and it's how these affect you and what you can do about it, which is the empowerment part of the book. We then take you through the #1 exercise that you must do to start on the road to feeling change in your body after you have had surgery. So with that, I want to share with you what we have in the book called the post-surgery cycle. And this diagram is pretty simple, but it's the biggest things that we see with every client after they've had surgery. Now, we never put a single client in a box of, this is you and you're just like everybody else, and these are the things that we're going to do with you. However, what we have seen is all of these things in common with people who've had surgery. So obviously there's pain after you've had surgery. If you've had surgery, you've had pain. We also develop scar tissue as we heal. We also have muscle imbalances of our deep muscles that help stabilize our body, our spine, and our joints. But then we also have overactivity or tightness of those big muscles that move us. And then we create compensations. And I'm going to break these down a little bit more. So when we think about pain after surgery, specifically abdominal surgery, I put a little circle here. Most people have pain in this area where they've had surgery, which totally makes sense. There's swelling, there's redness, there's pain. You've just had somebody, unfortunately, cut you open to help make you feel better. So with that, you have pain there initially. But over time, as part of that cycle, you will likely start to develop pain or tightness in different areas. And that is why we chose this picture for the cover of our book. And also the title, because it's what lies beneath. And it's much bigger than just that space on your body where you had surgery. So then, as a natural part of the healing process, we develop scar tissue. Now, we call this the iceberg effect because oftentimes people think of just the scar. And if you remember in the Titanic, it wasn't the tip of the iceberg that got the ship in trouble. It was the part of the iceberg that they could not see below that caused all the problems for them. And that is just the same as a scar versus scar tissue. A scar can be uncomfortable. It can cause discomfort. It can feel tight. It can feel itchy. It can feel numb in that area. However, it's what lies beneath the scar that has healed over time within your body. And scar tissue can be a thing, or it is a thing, that they can't see on any kind of test. So it makes it really hard for a doctor to say to you, you have scar tissue, and that's what's causing you problems. Scar tissue is the body's natural way of healing to close things up. If you've ever had a pretty big or significant scab, you may feel that stickiness as it heals, and may feel a little itchy as it heals. However, when we start to talk about scar tissue in the abdomen, we have lots of things inside our abdomen that are really important that they remain healthy and mobile. And so in the bottom of our iceberg here, I put, we have muscles, we have nerves and organs and blood vessels and other things as well, lymph, all these different things that are inside our abdomen that must remain healthy and fluid. And unfortunately, what happens oftentimes is scar tissue sticks to those things. It adheres them to one another. It winds around them. And you may or may not feel any of that happening. However, when you start to talk about the organs being stuck in this sticky, gluey type substance, that can start to create problems like problems with breathing, unable to fully inhale or exhale. It also can create problems with elimination, constipation, and urinary tract problems. So it can create a lot of problems for people if scar tissue starts to wind around or stick to it. It also can create problems with nerve type problems where you might have undescribed pain or numbness and tingling for no apparent reason, but it also can stick muscles to muscles. So just to give you an idea of kind of what scar tissue does, if you go ahead and you just pull down one part of your shirt, pull down one corner of your shirt, and then try to turn, you'll feel a resistance or a pull maybe in the opposite side of your shoulder. That's what scar tissue can do as well. It will make it hard to move in certain places. But again, you might feel that up here, even though the scar tissue is pulling down here into that lower part of your abdomen because of just the interconnectivity of our body. So that's scar tissues and scar in a tiny little bit. The next thing that can happen is muscle imbalances. And we think of muscle imbalances, you want to think about those big movers that you think about working out, your abdomen, your abdominals, your big back muscles, your lats, your big erectors that run down your spine, and your glutes. Think of those big muscles. Because your body has been compromised, those guys get really tight to protect you. And if you want to think about any kind of injury you've ever had, if you've ever sprained an ankle or broken a bone, you may have felt that immediate response of your body to swell and tighten around the area of injury. The same thing happens when we have an injury, when we have surgery. These are our big core muscles. They're the ones, their primary job is to move us. However, we also have deep muscles, and their primary job is to stabilize us. They stabilize our joints. They keep them stacked and they keep them centered. However, when we have surgery, they're little muscles. And what happens is the big muscles are starting to take over because they're trying to protect. The small muscles then start to lose their ability to stabilize. What's really important is these are important muscles because they stabilize your spine. They stabilize your hip. And they also help you breathe. So if these muscles are not working their best, you're going to start to create a lot of problems in the area of your core. And when you think of your core, think of more than just your abdomen. Think of your rib cage, because we do a lot of breathing in our rib cage. Things can start to get stiff and really rigid and be very hard and very challenging to move. So we start to get these imbalances. So there's a decrease in our small muscles that help stabilize us, and then there's an increase in tension in the big muscles that move us.
So Jenice, I'm gonna just real quick, because I know probably I did say the female core when I was promoting the webinar, but this information can be the very same for guys, right? It's not a male-female thing, right? It's anybody.
Correct.
Okay.
And that's actually was one of those things I was thinking, Jackie, because I was getting ready for this, was surgery is not biased towards one sex or the other. It doesn't care. The results are the same. So finally, in our post-surgery cycle, we develop compensation. And compensation is the body's natural way to get the job done. So it's going to take over and do something different because something's not working right. It wants to correct it. But what happens is you get this increase in function of one area versus another area. And I think that oftentimes we can get this idea if you've ever had a joint replacement or any kind of major surgery like that on a joint. When you're done, you don't get to just get up and walk out of the hospital and everything is fine. You're going to find yourself limping. You might be using a walker or a cane as you heal. But oftentimes we don't think about what happens after I've had abdominal surgery. I can still walk, might not be great, I don't feel well, but we don't see that I'm limping because this one side of my body is injured. Oftentimes clients will say, my back really started to hurt, or I felt really tight in my hips, or I felt like I was really squeezing my glutes a lot. I felt all this neck discomfort. If your core is not functioning the way you need it to, your body is going to find another way for you to stabilize and protect this area of your body. Because if you just think of your core as more than just muscles, and you think, holy cow, all of my vital organs are inside this rib cage and abdomen and pelvis. Your body has to protect that area in any way that it can, which makes our bodies the most amazing things on the earth. However, if you don't have someone who can come in and help you change patterns that you've set up over time after surgery, you will continue through this cycle. Because if you think of, if you've ever sprained your ankle or broken your ankle or had a hip surgery or any kind of surgery, you generally have follow-up care, usually some type of physical or occupational therapy. When we survey a room of 100 people in these courses that we teach, we'll say, hey, how many of you, after you had your C-section, your hysterectomy, your mastectomy, how many of you had follow-up physical therapy? The most we've ever seen is 2% of the people in the room. That's a very, very low percentage of people who are having major surgery and not getting any type of follow-up care except for just maybe a doctor's visit a week or 2 or 6 weeks later. So that's kind of a disruption and it doesn't make sense. But again, another reason why I felt it was so important to write this book and create this information.
So somebody that's watching us, Jenice, just now commented and said, I had no PT after any of my surgeries. And I know this particular individual, major abdominal surgery.
Absolutely, absolutely. And it's, oh, I see another one, Jackie. What's the next one?
I had really bad prolapse. A really bad prolapse be healed after C-section and mesh bladder sling put in to resolve prolapse, and and then only the mesh removed later, but the wings were left in because they could not be found due to scar tissue. The wings and the scar tissue involved are causing much tightness in the groin area when trying to stretch and do some types of exercises. I also had breast implants put in and had them removed 11 years later. No PT for either one of these.
Yep, that is the normal answer, the common answer. It's not normal, it's common. It's definitely the common answer. And again, I don't know why this is, but it's just how it goes. So that's, again, why we felt an absolute need to get this information out. And it's why we specialize in seeing women, and like I said, now men, because their wives have seen this and they're like, you need to go see these people after their husbands have had hernia surgery or something like that. So I'm posting this picture again here because, and you see I added arrows to it, because there's no rhyme or reason for when things start to, sometimes people call it flare up. We once had a patient who had her first child and only child via C-section at the age of 47. And she wasn't really a big believer in the type of work that we were doing with her. She was very much a type A personality, and a lot of what we help people do is really kind of calm down their bodies and their nervous system. And it wasn't in her wheelhouse at that time to be like, I don't know how this is going to help me. I don't know how this is going to help me. She couldn't feel anything happening in the session. And she was used to doing big, heavy type movements and exercises. So this didn't really seem like it was something that was going to help her. However, once she started to nearly fall asleep during every single session and realized that something was obviously happening if she could fall asleep, even though her brain was going a million miles an hour, she then told me, after we had a conversation about some of the research I was reading about how scar tissue can flare up in response to emotional stress. And there's studies going on around this. And she said to me, she shared with me that she had had to have a bowel resection because of bowel strangulation during what she called the most stressful time of her life. And scar tissue can have that significant effect. She's not the first person we've heard of having a bowel strangulation or obstruction due to scar tissue post some type of other abdominal or pelvic surgery. So that's what I'm saying. There's no rhyme or reason for this cycle. All of a sudden, one day your scar tissue can flare up and you feel horrible and you experience digestive problems, which is what a number of my clients will come in with, is something has happened. Either they ate something that wasn't quite right for them and it caused inflammation for them, or they've had some kind of emotional trauma or experience that has just done something to the scar tissue where it starts to tighten up and makes them very uncomfortable. But then people can start to create muscle imbalances for what appears to be unknown reasons, or they start to develop pain and they can't picture or figure out what possibly happened to now drive their pain. So one of these can drive another. There's no rhyme or reason. However, the biggest thing is that you have strategies to deal with them when they come up. And that's what we're going to go into in just a second here. So there is one exercise that you absolutely positively have to do in order to start to change the cycle of things you might be experiencing post-surgery. And before I get into that, Jackie, I just want to ask if there's any other questions about the information that I've shared to this point. Oh, I can't hear you.
Okay, so no other questions yet, but another person did post that they had 2 surgeries, navel down, no PT.
Yep. So the number one exercise that I'm going to share with you, and I actually want you to participate while we're here together. So if you have questions or anything like that, I can answer them for you while we're here together. This number one exercise can help decrease pain, improve your overall energy, because in the book we call it a sleeper effect of surgery. It can suck your energy. Even though you're 10 years after your surgery, you may find yourself at the end of the day not having anything left in the battery to give when it's time to get home and then just participate in the rest of your life. So it can improve your overall energy. It can improve how those deep muscles, like the muscles that stabilize your spine, like the muscles that stabilize your hip joint, and the muscles that help you breathe, it can improve their function while decreasing that superficial muscle tightness. It can also help mobilize scar tissue. And it can also just be a system reset for you and for your body. And that is 3-dimensional breathing. 3-dimensional breathing is the one exercise that every single one of our clients gets, and is the number one exercise that our clients come back and say, I couldn't do anything, but I still did my breathing because I know it always makes me feel better. I had a client before COVID took over our lives say to me, and she was a client I've seen on and off for the last 10 years, and she said to me, you know, I don't always get to all the exercises you want me to do. When I say all the exercises, I ask her to do 3. She says, I don't always get to all of them, but I always do my breathing. And she said, I went in to see my therapist that she talks to. And she said, my therapist said to me, hey, you seem pretty okay with all this chaos that's going on in your life right now. And she said, I told my therapist, I really think it is attributed to the fact that every day I make a conscious effort to do this breathing practice. My body feels better and my mind just feels clearer when I do this. Now, it's not meditation. It is an exercise. And so when we think about 3-dimensional breathing, I want you to think about this idea that when we breathe, we have many muscles of respiration. And many of those muscles experience changes after we've had surgery. And I mean immediately after we have surgery. There's actually studies out there that show you how the impact of even just the anesthesia that they give you can decrease the ability of how your diaphragm works immediately after surgery. So I want you to think about your diaphragm, which is a round muscle that sits inside your entire rib cage. As you inhale, it drops down. It's a round dome-shaped muscle. So it has to move all the way around. The whole thing has to move as you breathe. You also have tiny muscles in between each set of ribs. These are also primary muscles of respiration. They must be able to move and expand in between your ribs whenever you take a breath in. You also have muscles in your back that help with respiration. Any muscle that is attached some way to your rib cage helps with respiration. You have muscles in your neck that are attached to your ribs that help you breathe. If you find that you have a lot of muscle or neck soreness or tightness, it's hard to turn or move your head, you may find that when you change how you're breathing and you become more efficient with it, it will actually change the tightness and restrictions in your neck. So I would like us to do this together. But before we do it, because I want you to see and feel the difference in your body after just a brief exercise, we're going to do what we call a self-assessment. You're just going to follow me along in this little simple self-assessment, but I want you to get a sense of how your body feels before we do this very simple breathing exercise. And I want you to think of it as an exercise because we are working muscles so that you can feel the difference in your body. So go ahead and stand up. Oop, I see a question there, Jackie. Or is it just a comment?
Oh, it could be a question. Hang on. Okay. So she said, I'm almost 40 years post-emergency laparotomy. I'm so bad at medical terms. Thank you.
Yep.
20 years post-radical hysterectomy. I love three-dimensional breathing technique, but is there any help for the anatomical changes caused by scar tissue?
The anatomical, depends what they are. Can we get back to that one? Let's do this one, and then we can have her elaborate on that.
Yep. Perfect.
Okay, so everybody go ahead and stand up, and please spare my pictures of me doing this. This is actually video clips. These are snippets from a video I did. But you're just gonna stand, have your arms resting at your side, and all I want you to do is just turn your head and look over your right shoulder, and then come back to center. Look over your left shoulder, and come back to center. And I want you to repeat that again. Look over the right shoulder, come back to center. And as you do this one more time, right to left, get a sense of, does one direction move easier or further? Does it just feel like the quality of the motion feels a little bit easier as you go one side versus the other? Just kind of file that away. Now, standing with your hands on your hips, you're going to turn your body as far as your hips allow you to turn. So you're just going to stand with your feet together, hands on your hips, and turn to look over your left side, and then come back to center. And then turn to look over your right side and come back to center. And as you repeat this, again, do you feel a difference side to side? Does one side go further? Does it just feel easier to go to one side? Do you feel any discomfort as you go one side versus the other? Do that one last time and just get a sense of how that feels. Then the last one I'm going to have you do, and if you have any issues with balance, please be by a chair when you do this one or a wall. You're just going to stand with your feet together, and I'm going to have you lift up your right leg, put it back down, and then your left leg and put it back down. Again, raise the right leg, put it back down, and then the left leg. And as you do that, get a sense of how much effort does it take to get from one leg to the other. And does one leg or do both legs feel kind of heavy to lift them? Does it require a lot of effort just to lift them? Good, so just go and recall which way felt easier in your neck, which way felt easier as you twisted your whole body, and then the different side to side as you raised and lower your legs. Good, so now we're gonna go into our three-dimensional breathing practice. So remember, I told you that the diaphragm is a round muscle that sits inside of our rib cage, and we have all these tiny muscles in between each of our set of ribs that need to work as we're doing our breath. But as I take you through this process, always remember a few things. We're going to breathe in through our nose and out through our nose. We're going to do this because A, it creates just a longer space and time for our breath to go in and out. But when we breathe in through our nose, it actually helps purify the air that we're breathing in and also warm the air that we're bringing in. I also want you to think about taking nice slow breaths and listen to my words as I take you through this, because I never want you to push the breath into a space. I'm always going to use very light cues, so I want you to try to do that with me. Now, you can do your breathing in any position. You can do it in a seated position. You can do it in a lying down on your back position. You can do it on your stomach. You can do it in sideline. You can pretty much do it in any position. For the sake of the fact that we're all probably sitting at computers and not laying down and looking at our computer, I'm going to have you do it in a seated position. But I want you to sit in your best posture. And your best posture doesn't mean sitting up straight like this. Your best posture is making sure that you're sitting up on your sits bones. So making sure that you can feel your sits bones in contact with the chair that you're sitting on. And your feet should be resting comfortably on the floor. Now in the first picture, you can see I have my fingers down into my pelvis. And that's where I want you to put your fingers. So they're down onto your pelvis and the lowest part of your abdomen. What I want you to think about is you're going to take 3 breaths here. You're going to breathe in very gently in through your nose. And I want you to think about sending that breath down into your hands. Again, it's a nice, easy breath. I don't want you to feel like you're pushing your breath. And this breath is more than going into your abdomen. Think about your breath going below the level of your belly button. So you're going to take 2 more breaths, breathing in through your nose, allowing that breath to find your hands. And then you do a nice, gentle but full exhale, letting the air come all the way back out through your nose. Have a complete exhale before you take that next inhale in. Again, gently sending that breath down into those hands, nice and easy. And then as you exhale, allow that breath to come all the way back out through your nose. Good. Hopefully all of you felt like that was relatively easy. However, I will tell you that many women who report who've had C-sections or tummy tucks or any type of surgery where they have that bikini type scar, they do struggle oftentimes getting that breath all the way down into that space. And that's okay. This is just practice. So now I'm going to have you put your hands on your rib cage. There I have a strap. So if you're not comfortable putting your hands on your rib cage, you can use some type of strap or belt or band and wrap that around your rib cage. Now I'm going to have you think about sending that breath out into your rib cage. But again, it's not this big breath where you feel this big expansion. Picture your lungs. I'm going to give you this picture back here of the lungs. Picture your breath filling out into all those little tubes inside your lungs as you breathe out. And then as you exhale, picture all that air coming back out. So again, you're going to breathe in through your nose and then exhaling fully and gently out through your nose. Again, you're going to breathe in through your nose and exhaling fully and gently out through your nose. And then go ahead, one last breath here, gently filling out into your lungs, allowing them to expand, and then exhaling fully and gently, allowing that breath to come out through your nose. The last area that we want to think about getting our breath is into our back. Remember, I said that diaphragm was this round muscle. And so now we've talked about getting the breath down, we talked about getting the breath out. Now we need to think about getting the breath into our back. So if you can, where your fingers are, just think about gently wrapping them around a little bit further into the back side of your rib cage. And if you can't, if you have a little band or something, that's great too. But now you're going to think about sending that breath back very, very gently into your back or into your spine. So again, you're going to breathe in through your nose and out through your nose. Again, allowing that breath to just very gently feel like it's spreading across your back, along your spine. And then as you exhale, nice and gently, allow the breath to fully come out before you take another breath in. So you're going to take another breath in through the nose, allowing it to spread across your back. And then as you exhale, allow that breath to come all the way out, gently and fully through your nose. And then,
Jenice, I know that, I've been a practitioner of 3-dimensional breathing for about 3.5 years now.
Mm-hmm.
And I remember when I first started this process, it was almost like the breath got caught. It was like you were breathing deep, and then you kind of like to have to almost go to that second breath to like get it moving, right? That's it can be that a common thing for people that are new to this type of breathing. Yes?
It can be, yep.
Takes practice.
It does take practice, absolutely. So now we're going to do 3 last breaths. And as you're doing them, I just want you to mentally connect to the breath low into the pelvis, out into the ribs, and then into your back. And I'm just going to take you through that. So we're going to do 3 breaths just like this. So breathing in gently through your nose, allowing the breath to go low, into the ribs, and into the back. Gently breathing in through your nose, feel the breath low, out into your ribs, and then into your back, fully exhaling. One last breath, in through the nose, allow it to go nice and low into your pelvis, feel it out into your ribs, and then expanding across your back. Good, just go ahead and rest there for a minute, because now what I want to do is I just want to go ahead and reassess. So when you're ready, go ahead and stand back up. And we're just going to repeat our self-assessments. So I'm going to have you go ahead and very gently just go ahead and turn your head over your left shoulder, come back to center, and then to your right, and come back to center. Repeat that again. And as you do this now, do you feel just a little bit of difference? Does the range that you go, is it just a little bit further? Does it feel a little bit easier as you turn right, coming back to center, and going to the left? Now, standing with your feet relatively together, hands on your hips again, you're going to go ahead and turn your body or your hips as far as they go to the left, coming back to center, and repeating to the right, come back to center. And again, as you go to the left, check and see, does it feel more equal side to side? Does it feel like you can move a little bit further? Do you feel any less discomfort as you're doing these motions? And then lastly, if you need it, be by a chair or a wall, we're going to check your balance. Bringing feet together, you're going to go ahead and raise that right leg and put it back down. And now the left. And just get a sense of, as you raise and lower each leg, is there just less sway as you go side to side? Do you experience that it's just a little bit easier to lift the legs? Do they feel just a little bit lighter as you do that? Good. I hope that you participated, because I can't see you. And I hope that you did experience some type of change. Now, we just did this for about 3 or 4 minutes, and it is the exercise that you have to do, like eating your vegetables and brushing your teeth every day. It is that type of exercise you have to do every day, several times a day, and it doesn't take a lot of time to do that. I see a question, Jackie. Oop, I can't hear you.
I keep forgetting to unmute. Okay, Anna said it made a difference.
Awesome, thank you, Anna. I appreciate that. So one of the things we talked about earlier was scar tissue. And when we breathe, so the diaphragm is, like I told you, this round dome-shaped muscle, and below it is your pelvic floor. As we breathe, as the diaphragm lowers and the pelvic floor lowers in response to that, this motion actually helps mobilize and create movement in our organs. So you have your liver and your stomach that sit up inside of your diaphragm. So as you breathe, they lower. There's pictures of how much your kidneys actually move with deep inhalation. And I will tell you that the clients who have come to me who have bowel obstructions, I recently had a woman who had chronic bowel obstruction. She had them every 3 months to the date after her surgery. And she came in because she didn't want to have to continue to go to the hospital every 3 months. And I only saw her once a month. And her number one exercise to do was breathing. And she, her entire life, was a ferocious reader. And when she would read, she would breathe like this while she was doing that. So you can imagine you're not going to get a lot of movement in your body if that's how you breathe doing your primary hobby. So when we taught her how to breathe differently, it was the only thing she did differently in her entire routine of life. And it has been over a year since she's had a bowel obstruction. So it's the only change that she made. I saw a gentleman years ago, he was a university professor and had 6 abdominal surgeries for cancer and was in the hospital constantly for bowel obstructions. It was the only thing he told me he would do on his own when we weren't together in session. And the entire time I saw him, he did not have any bowel obstructions either, and that was for a whole year. Unfortunately, when he moved away to another country, he did start to have them again. But he did go an entire year, and he too was at the hospital almost every month with bowel obstructions. So this is why breathing becomes so important just for mobilizing your abdomen. I have other clients who do it. They see an improvement in their overall digestion from doing the breathing. So it can be very powerful. That's just one of the things it can do, is help mobilize that area. However, it does do all of these other things as well. And I will tell you from how does it improve my deep muscles? As we talked about a little bit earlier, so much of our body is connected. And we actually go into anatomy cadaver labs, we can actually see how the diaphragm, this dome-shaped muscle, is actually interconnected to the deep muscles of our spine, those little tiny muscles that help control segments of our spine, that help control and use the internal corset called our transverse abdominis muscle. These guys are all interlaced muscular-wise, and when we breathe, they actually help contract those muscles at the rate and speed in which they need to be contracted. And those muscles are really important because they need to turn on before we do big movements. And when they don't, then our body starts to compensate in response to that. So, does anybody have questions about the breathing or anything that we talked about today? Can you repeat the question we had before we started this, Jackie?
Yep. Hang on one second, Jenice. I have somebody that actually texted me a question, I think. Okay, so my friend who has extremely tight respiratory muscles between her rib cage and in her lower pelvic muscles, she can barely do a hip hinge. Just wondering if she's had any people who were pregnant doing these 3D exercises and how it went for them farther along in their pregnancies.
Okay, wait, so that person that she's speaking about has tight muscles? Is this all the same person she's referring to? Or is that 2 different questions?
Yes, same person.
Same person. So she has tight muscles between her ribs and she has pelvic floor tightness?
She's really, we've talked about this girl before,
okay.
Very lower pelvic muscles. When I say we, meaning Vicky, the gal that's asking me.
Okay.
She is so tight, she has a hard time actually even doing hip hinging. Okay. Mm-hmm. And now she's pregnant.
Yep.
And just wondering if the 3D breathing exercises will help for them. And if I'm guessing she means is there any harm in doing these the further along you get in pregnancy?
No, there's no harm in helping people improve their breathing. And I can actually say that clients who work with us prior to giving birth have actually said that they do this type of breathing while they're actually giving birth, and that this is what's helped calm them down and get them through the delivery process as well. And if everybody's still with me and they want to do this with us, when you have clients or you yourself feel like those deep muscles are just really tight and they restrict you from moving, what you can do is use imagery, which I know doesn't sound like it's effective, but it's highly effective when executed correctly. And when we think about, so I talked about how the dome of the diaphragm is here, but then your pelvic floor muscles below that are also dome-shaped muscles as well. And they sit in that bowl of your pelvis. And when we breathe, they should move as well. However, if they don't move, then everything is just kind of getting jammed up against those muscles. Then you're not getting that full expansion that you're actually looking for. However, when you breathe, when you think about sending that breath nice and low, if you can feel your sits bones, if everybody wants to do this with me, it'll just make it easier. So if you can feel your sits bones in contact with the chair that you're sitting on, and think about sending that breath nice and low into your pelvis, think about that breath going all the way down into your pelvis in between those sits bones. And then as you exhale, think about those sits bones relaxing and staying open. And do that 3 times. inhaling gently, allowing that breath to go down in between your sits bones. And as you exhale, allowing those sits bones to stay open and relaxed. And if you repeat it one more time, gently breathing in through your nose, allowing that breath to come all the way down in between those sits bones. And as you exhale, imagine those sits bones remaining open and relaxed. Now for your client who's also is challenged with a hip hinge, this is a great way to cue her as well. Because if you have her start in standing, inhaling, and then as she exhales, imagine her allowing those sits bones to relax. That idea is going to take away that clenching because she's got to unclench as her sits bones relax, and then going into the hinge. You also can use the cue of creating space front to back in the pelvis from the tailbone or the coccyx to the pubic bone. That's another great way for people to think about starting to relax those deep pelvic floor muscles that can oftentimes get restricted.
So you asked me to go back to the first question that we had, and she responded back and said, I think you answered my question in that breathing, when we practice it regularly, could restructure scar tissue through the movement of the air or the breath around it.
Correct. Yep. It will, that mobility that is created when you breathe from the diaphragm, essentially mobilizing and massaging your organs, is the biggest, most effective thing I found for people to be able to do on their own if they can't get to see a manual therapist.
Okay. Somebody asked, can a bad uterine and bladder prolapse be reversed?
I have not seen that, and bad is a relative term. It depends how significant it is. Oftentimes there's surgery related to it. The biggest thing that has to happen after surgery, though, is changing the strategy that may have contributed to it. Now, granted, giving birth and those types of stress can create that for people, but you always want to make sure that after you've had surgery, that you're starting to change a strategy that would take you away from doing things that would create a bearing down type of movement, because it is a pressure system in your abdomen and your pelvis. We always want to try to decrease the pressure when we're at rest in those positions. Again, that's more of a question for your doctor or for a pelvic floor therapist.
Cool. Anybody else? Chat box and Q&A is quiet at this end.
Okay. So I will say that if you're looking for more information, the book is just 99 cents on Amazon. If you do have an Amazon Kindle Unlimited package, it is free on there to read. The video that actually takes you through the exercise we did here is available for free on our website for 45 days. And that's www.imsinchicago.com/store or / I never know which that is. But it's imsinchicago.com/store. Is there a question, Jackie? I can't hear you.
Karen said she's ordered the book.
Oh, awesome. The book is written by myself and my co-author, Sarah Fisher, who is my colleague who works with me. And the book is written for the user, while other professionals have found it helpful to understand what happens to their clients after surgery, as well as explaining to their clients why certain exercises they might be doing are good or not good for them in the moment. But it is Sarah's story of her life after an unplanned C-section in her 20s and what she experienced going forward as trying to be a professional dancer after a significant surgery, and all the signs and symptoms that she felt in her body, and how after we started to work together within 18 months, she started to feel a new sense of normal. And the biggest thing I can say is we always talk to people about getting you to move beyond the symptoms that you're experiencing and focusing more on the activities that you really need, want, and love to do, and then helping you understand how those very specific exercises we create for you help you move beyond those symptoms so that you can return to those things that you really need, want, and love to do.
So Elsa's asking if the breathing exercises can help with incontinence.
Yes, they can. So when we breathe, I say yes with a caveat, because if there's something more going on, and if you have not seen your doctor or pelvic floor therapist, those are two great places to start. But what breathing does when it comes to incontinence is when we breathe, it helps to elicit what the pelvic floor is supposed to do in response to that. One of the things we ask people to do is to really think about their patterns that they have throughout their day. So it depends what type of incontinence a person has. I don't know if the person's elaborating on that or if it's a different question.
No, somebody asked me to post the web address for the free breathing exercise, so I was doing that.
Okay.
But the person that asked about the incontinence has not elaborated.
Okay, so I will share a story. So we, as Jackie has said, she's been a part of some of the programs that we teach other professionals. And in our advanced program, the students do case studies. And one of our students wrote to us that I believe she was an 83-year-old woman who had incontinence, and she was changing her pad 4 times a day. And this was a person who was teaching her how to do the breathing. And the woman wrote to her, 2 weeks ago, I only had to change my pad 1 time, and this week I haven't even had to change it. So that was within 4 weeks of just spending time working on breathing. Now, that's not, again, I have to say it with, that's not everybody's story, but this was a woman who, she wasn't even specifically working on changing her incontinence, but she was having her do a regular practice of breathing along with her other exercises. So we have had stories of success with that.
That's an awesome one. Okay, so the gal that was making the comment about the incontinence said problems with urgency and leakage that she cannot control. Stream.
Mm-hmm.
Yeah.
And we do know as we age, it does change the tissue of our pelvic floor and how we are able to control things like that. However, if you are a person who tends to be what we call a gripper, where you tend to hold maybe your abs in, or you feel like you squeeze your glutes a lot, those can create problems of pressure and create urgency when you are trying to not have to go to the bathroom. And so if you're able to change some of the patterns of habits created over time so that your pelvic floor muscles can freely do what you need them to do, the breathing can be really, really helpful.
Cool.
Anything else?
I don't see anything else. Anything else from you? Perfect.
Yes, I have one last slide. So this is from the Lorax. Dr. Seuss is my favorite author. So I want to thank Jackie, but also, oh wait, there's one more question before I give my big thank you.
Actually, she said, thank you so much. This is great stuff.
Awesome. So we've known Jackie now for several years, and we've spent time with she and her husband in their facility. And if you are one of Jackie's clients or you're in the community with her, you know that she has stepped up more than ever. She always is in front of you. She's in your face. She's encouraging you. And I will say that I've been watching her on Facebook, and I thought this quote was perfect for her. Unless someone like you cares a whole awful lot, nothing is going to get better. It's not.
Aw. Thank you.
Yes.
Yeah, it's, oh, I got some stuff here. So Rosemary said, I have thoroughly, in really capital letters, enjoyed this seminar. I'm so glad, Rosemary. Thank you. Elsa said, thank you, very informative. And Patricia said, thank you both for this webinar. It's been very informative. You're welcome.
The only thing I say is, if you could take anything away from what we talked about today, is if you can just practice this breathing. I speak from personal experience. Even though I have not had surgery, I have had a long history of migraine headaches. And this practice is what has kept my migraine headaches away for almost 20 years and has taken me off of all pain medication.
Yeah, I just, in 3 years of participating with you and Dr. O, the stories that you share through the seminars and everything, the one that I really love is when you talk about, you related it back to your childhood, like, living within your boundaries. I love that story. And it really, I think sometimes we think that exercise has to be really hard, right? And that you always have to be feeling something to know that it's working. And in breathing, you do feel it.
Mhm.
But it's just not that hard, like slamming intensity when we're doing rigorous exercise, right?
Mhm. And I think that's important, especially when we were talking about the difference between those big and small muscles that are affected by surgery. And those small muscles, they're not movers, so you can't necessarily feel them doing their job. However, you will start to feel when they're not doing their job. And so the only way we can truly access them, or we can start to see a change with our clients, or they can start to feel a change in their body, is by assessing what they're doing. And that's why we gave you your own self-assessments, but also when we have them do their breathing, because the breathing is connected to those small muscles that are so important, but that we don't talk a lot about, but they're not necessarily muscles that we exercise.
So Patricia also said, thank you for the information about migraine and breathing. I will practice these for migraines. I do happen to know that Patricia suffers from migraines pretty frequently. And she said, sometimes when it's hurting so badly, it's hard to do, but she said, I will take your advice and do it.
I will tell you that again, like I try to say this as much as possible. It's really about a regular practice. We've helped people who struggle with any type of PMS related pain and discomfort as well using these breathing techniques. And it it's as important as brushing your teeth every day, because life has taken us out of the natural way in which we breathe, either if it's stress related, if it's how we've been told to stand, walk, our posture, it's the way we exercise. So much of it has taken us away from the natural way that we're supposed to breathe, and this is about restoring the natural way in which we're supposed to breathe.
Awesome. Thank you, Jenice, so much for
Thank you so much,
sharing your
Becky. Thank you
time.
for everybody who is on with us today. I appreciate it. Thank you for letting me share.
Uh, Corrito Garcia said to everybody, thank you and God bless you.
Oh, God
Aw,
bless
thank
you.
you. So if somebody has questions, if you get off of this webinar, or if you're somebody that's coming back and watching the replay later and you have questions, please send them my way and I'll filter them over to Jenice and see if we can't get some information back to you. Okay. We appreciate your time today, Jenice. How's the weather in Chicago? Are you guys making it?
Yeah, it's like it's springtime here. So, it's 80 and then it's 40 and then it's 30 and then it's snowing, and it snowed twice in the last 2 weeks. So I don't know if it has to do with COVID that it's even crazier than normal, but it does feel a tad bit crazier than normal springtime here. So,
Yeah.
but we've been enjoying some warm weather, which has been nice. Unfortunately, we're not really allowed to go out too much and enjoy it, but it's okay. We'll take it.
Yep, absolutely. Well, we wish you and Dr. O the very best. I hope you guys have a great weekend and we'll be in touch soon.
Awesome. Thank you, everyone. Have a wonderful day and be well.
Bye. Thank you.